And this is a collaboration webinar by the Michigan PSR, Texas PSR, and Chesapeake PSR chapters. We had the idea to try to make this all come together because we're all working on issues surrounding coal. And so we wanted to invite Alan to be a part of trying to break down, trying to educate our people, our health professionals, and move forward our agendas in our states. So I'm Stephanie Dernick, and I'm with Michigan PSR. We've been around for a big whopping almost. And coal is a big issue for us because in Michigan over 60% of our energy comes from coal. And so this is a big part of what we're working on here in Michigan. So thank you all for joining us, and I'm going to turn it over to Chris in Texas.
In Maryland, we're particularly interested in the health impacts of coal. We have some of the worst polluting coal-fired power plants on the East Coast, and unfortunately, a number of those are located in very populated areas. The state has proposed, or will soon propose, standards to strengthen emissions for nitrogen oxide and sulfur dioxide from coal-fired power plants in Maryland. We think this is a great step, but we don't know how stringent they'll be. And so we are particularly interested in having the health voice participate in these discussions in Maryland as stakeholders to make sure the state has the most stringent standards possible. And if they do, we feel a couple of these coal plants will have to shut down. They're just not worth running anymore, and some of them have no SO2 standards. And so we're looking for volunteers, people in the health profession or otherwise, to help us. And so please contact me at twhitehouse@psr.org if you're interested in helping out. Thank you again, Dr. Lockwood.
All right, so I think we should move into the webinar and the content that Alan has prepared for us. I just want to give a little background on Alan. He has been a long-time PSR member and has been a part of the leadership. Currently, he's working in the Environment and Health Committee and has written a report for PSR, Coal's Assault on Human Health, as well as a book that he published, wrote, The Silent Epidemic, Hidden Threats to Health. Alan is an expert in environmental factors and neurological disease with special reference to pesticides, and has been a leader in the health and coal work. So we are thankful for Alan joining us tonight, and I hand it over to you.
Thank you, Stephanie, and everyone else who's out there in the silent audience. It's a pleasure to be here, and I hope that this will be a worthwhile evening. I think what we will do is hold questions to the end, and hopefully there'll be an opportunity to do that. I hope you can all see this introductory slide here, which has the title, Health Impacts of Coal, and the cover art for the book that Stephanie was kind enough to. I encourage people to buy it. I always ask them to go to their local bookstore as opposed to Amazon. where the proceeds to both the publisher and the royalties are better. All of the royalties are being donated to Physicians for Social Responsibility, so I don't feel at all guilty about this shameless self-promotion. So this is an overview of what I'm going to be talking about. I'll define health, talk a bit about health and coal's life cycle starting in the mine. What happened here? All of a sudden my screen went blank. A bit about the transport of coal, burning coal, coal ash. Focus quite a lot on air with 4 of the 6 criteria pollutants plus mercury. Finish up with global warming, which may be perhaps the most important topic of the coal saga, and talk a bit about Clean Air Act and economics. If this were a continuing medical education audience, I would indicate that there is nothing to declare. I'm not being paid vast sums of money by the coal industry or anyone else to do this. So here's the definition of health that was put forward by the World Health Organization in 1948, and I still like it. It says health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And having said that, I will talk mainly about disease or infirmity, but remember that behind every disease there's a mental health and a social aspect of well-being that goes along with that. Now there are a couple of myths that I'd like to start off just by addressing, because you'll hear them all of the time if you're going to be out there talking. First of all, clean coal. Well, my answer to that is, how can you refer to a product when used as indicated causes tens of thousands of deaths per year? It's not a clean source of energy. And you'll also hear that coal equals jobs. And it's true that there is enormous poverty in Appalachia and other mining areas, and the main reason for that is that coal mining has become increasingly industrialized, and a lot of miners who used to have well-paying union jobs are now left skillless, sitting on their front porches. Yes, coal makes jobs, but most of those jobs these days are in the healthcare industry, as we will see here shortly. Now, Stephanie alluded to the fact that coal is an important source of energy for generating electricity. This slide shows that at the time that I made it, which was about a year ago, coal accounted for about 43% of the energy that was being used to generate electricity in the United States. This is falling continuously. It's now probably somewhere around 40 or 41%. And natural gas is increasing in its prevalence. Now, it's true that when burned, natural gas produces less carbon dioxide per BTU of heat energy generated than coal, and much, much less in the way of criteria air pollutants. So at the combustion phase only, natural gas is a cleaner source of energy. But there is a hidden story about natural gas and methane that has to do with the enormous amounts of methane that are released during the drilling, transport, delivery operations of methane to the user. And the fact that methane is a much more potent global warming gas than carbon dioxide, that caused some to say that natural gas and the methane that's the principal component of that is an even more important global warming gas than the carbon dioxide that's produced by burning coal and natural gas. Now, one of the first indicators of the health effects of electricity generating was published in The Lancet in 2007. And these authors looked at generating electricity in Europe and concluded on the basis of detailed analyses that lignite, which is a poor form of coal that's particularly prevalent in some of the countries like Kosovo, which I visited a year and a half or so ago, about a year ago actually, and other coals produce between 25 and 30 or so deaths per terawatt hour of electricity generated, and much larger number of serious and minor illnesses. as opposed to oil, natural gas, and some of the other sources of electricity. Now, to put that in some kind of perspective, in the United States, we generate around 4,000 terawatt hours of electricity per year. So if you multiply, say, 25 deaths per terawatt hour times 4,000, and take into account that something like 40% of that 4,000 terawatt hours comes from burning coal, you get some idea in a very crude way of the impact that this is having on health. Now, one of the first more detailed studies of this in the United States was done by the National Academy of Sciences in a publication called Hidden Costs of Energy, which you can read on the National Academy of Sciences website. It's somewhat cumbersomely page by page. But this is one of the figures from there, and the size of it, with the location of each of these dots on this map of the United States, corresponds to one of the 406 coal-fired power plants, and the size of the dot is is an indicator of the external costs, and what they mean by external costs are the health impacts. The bigger the circle, the higher the health impact. And you can see that these are clustered along the Ohio River Valley and parts of the eastern seaboard, where most of the very old power plants are located, the ones that have the fewest pollution control devices, as was alluded to by Tim Whitehouse. Now let's turn to the mining of coal. In 1969, because of the very high prevalence of black lung disease, or Coalworkers Pneumoconiosis, there was federal legislation that created an X-ray program for detecting black lung disease and set standards for coal dust in the air. And as a result of this, between the 1970s and 80s, the prevalence of black lung disease in mines of various sizes that are shown by the different colored bar graphs in each of these decades went down. But beginning in the 1990s and continuing on into the 2000s, the prevalence of black lung disease, particularly as shown by the red bar, in small mines that employ between 1 and 49 miners, started to increase. Remember, there are more and more of these mines because mining itself is becoming more highly mechanized. Now, you don't have to be a coal miner to suffer some of the adverse effects of coal mining itself. This is a study by a fellow by the name of Hendricks, who's relocated recently to Indiana. And he and his colleagues did a lot of public health studies in West Virginia. And to summarize what they found, that as coal production increased, health status worsened, and the rates of a number of serious illnesses rose in proportion to the amount of coal that was mined. And here's one specific sample to illustrate that. For chronic obstructive pulmonary disease, if you lived in a county where less than 4 million tons of coal were mined per year, the odds ratio for contracting COPD were 1. Basically, no increased risk. But if you lived in a county where more than 4 million tons were mined, the risk was about 55% or so higher than if you lived in one of these low mining towns. Now, a lot of the coal that's mined in the United States and also elsewhere gets transported by railroads, and that's becoming an increasingly troublesome problem, particularly in the Pacific Northwest, where the prospect of a very large increase in the number of coal trains that are projected to move coal mined in the Powder River Basin to ports on the West Coast where it'll be transshipped to Eastern Asia. In the United States, about 70% of all rail traffic by ton is related to coal transport, and per ton mile, rail accidents are much more common per ton mile than road traffic. And in addition to that, diesel locomotives emit small particles that are harmful to health, as do the trucks that have diesel engines, and also cause wear and tear on roads that also generates small particles. Finally, not shown on the slide, but as these coal trucks rumble down the tracks, dust comes out of them, and that poses additional hazards. And this is an example of one of the more dramatic hazards that's posed by these train transport. A train derailment in August of 2012 that killed 2 women who were standing too close to the tracks. Now, once coal is burned, about 10% of it is left over as ash or coal combustion waste. And since we burn about 1 billion tons of coal each year, we generate about 100 million tons of coal combustion waste. And ironically, as pollution control devices become more efficient, as mandated by the Clean Air Act as well as state and other regulations, this ash becomes more toxic. It has larger concentrations of heavy metals such as arsenic. And this ash is largely unregulated and often stored under substandard conditions where these toxic metals can leach into groundwater, dust forms and pollutes the atmosphere, causing an inhalation hazard. And occasionally, as occurred in Kingston, Tennessee, in December of 2008, the dams that hold back these slurry ponds will rupture. And when this one happened, an 84-acre lake spilled over 1 billion gallons of coal combustion waste and water slurry into adjacent rivers. And as I mentioned before, dozens of other sites, arsenics and other toxicants have leached into groundwater, and in many places the water is no longer drinkable and doesn't meet federal standards for drinking water purity. Now the rubber really hits the road, so to speak, when you burn the coal. And in an EPA report to Congress in 1998, there were over 60 hazardous air pollutants that were released by coal combustion, and these include oxides of sulfur and nitrogen, arsenic, beryllium, cadmium, chromium, mercury. I'll have more to say about mercury in a few moments. Nickel, hydrochloric acid, hydrofluoric acid, organic compounds such as acrylamide and dioxin and formaldehyde. And there's also small amounts of uranium and thorium that are present. These are, of course, radioactive elements that are in the coal when it's formed. Now, when the EPA was established in 1970, it was charged with identifying pollutants that are harmful to health and the environment and creating national ambient air quality standards and NAAQS for these 6 criteria pollutants. And these are carbon monoxide and lead, and I'll not have any more to say about them. Oxides of nitrogen, which in the presence of volatile organic compounds, including methane, from natural gas wells, goes to form ozone, ground-level ozone, which is an irritant. So nitrogen dioxide is an irritant, as is the ozone. Small particles, particularly those that are 2.5 microns in aerodynamic diameter, inhale deeply into the lungs, where they trigger a cascade of pathophysiological and inflammatory reactions that produce local damage as well as damage that's widespread in the body. Sulfur dioxide, clearly the leading source of sulfur dioxide emissions is burning coal, and sulfur dioxide too is a pulmonary irritant, and perhaps more importantly, it's highly reactive chemically and combines with other compounds in the atmosphere to form even more of these small particles. So these particles are formed directly by the combustion process and secondarily by the condensation of sulfur dioxide and other components in the atmosphere to form these small particles. And then, of course, we also have mercury. As I said, I'll come back to that in a few moments. Now, there's a huge number of studies that have been done and published in leading medical journals that clearly link air pollution, particularly that is produced by burning coal, to at least the 4 leading causes of death in the United States. And these are heart disease, malignant neoplasms, not just lung cancer, but others, respiratory diseases, including asthma, emphysema, bronchitis, and cancer, of course, and stroke, which is the 4th leading cause of death in the United States. And now there are beginning to be some indications that are growing stronger every time a paper gets published about this, that some other common health threats such as Alzheimer's disease and type 2 diabetes mellitus are also quite possibly related to pollution that comes from burning coal. Now, as I mentioned before, these criteria air pollutants are associated with ambient air quality standards, and there's a variety of networks that monitor the concentration of these criteria pollutants around the country on a more or less continuous basis. And when that's done, we find that roughly 125 to 130 million people live in counties in the United States where these ambient air quality standards are not met. And the trend is, as we learn more and more about ozone and particulates, we realize that they're more and more dangerous. In fact, there are no, what are sometimes referred to adverse, no adverse event level present for any of these. So any increment or decrement will have an effect on health. So as we learn about the increasing number of diseases and the severity of diseases that are linked to these pollutants, the trend has been to lower the standards, which means that the air quality should be better as a result of that. But even in spite of this, and in spite of provisions of the Clean Air Act, and we'll come back to that, there's still over 125 million people who live in counties where the air is not clean enough. Now, I mentioned that there are monitoring sites established by states and the EPA and others around the country to monitor air quality on a continuous basis, and you can see this in your air quality index that's usually a part of the weather forecast both on television and in newspapers. But recently it's been possible to use satellite technology to measure at least in small particle concentration. And this is a map of this, and more EPA is coming to rely on satellite measures and less on these stationary sites. Now, I mentioned that there are a number of epidemiological studies that link air quality to morbidity and mortality. Two of these are the Harvard Six Cities studies and the American Cancer Society Cancer Prevention Study. And both of these show clear, statistically significant links between increasing amounts, particularly of small particles, in cardiopulmonary and respiratory diseases. And other studies have shown increases in acute myocardial infarcts, defibrillator discharges, and myocardial ischemia. Now, as you probably saw in the introductory slide, I'm a neurologist, so I'm particularly interested in stroke. And again, there's international consensus and studies that have been done worldwide in Korea, Taiwan, and the United States that link air pollution, including that's derived from burning coal, to increases in the risk for developing particularly an ischemic stroke. I'd like to pay some specific attention to the Women's Health Initiative, in part because a good deal of that was done here in Buffalo, but because of the value of the study. This is a study that enrolled over 64,000 postmenopausal women who at the time of enrollment were found to be free of cardiopulmonary disease. And then these women were followed prospectively every year for an average of about 7 years. And then when they reached an endpoint, a cardiovascular event, such as a need for coronary artery bypass grafting, a myocardial infarct, a stroke, or a then they were seen, and these prospectively followed women were recorded as having had an event, a primary outcome. And these investigators found among these 64,000 odd women that the 10 microgram per cubic meter increase in the small particle concentration was associated with a 24% increase in the risk of one of these cardiovascular events. So the fact that this was a prospectively done study gives it additional weight in terms of the validity of the conclusions that were reached. Now, as I mentioned, there are air quality monitoring sites around the United States, and each one of those has a geographical point that is known exactly. And hospitals and the zip codes where people have strokes are also known. So when patients with strokes come to the hospital, it's very important to find out exactly when, if at all possible, that stroke took place, because there are important therapeutic decisions that are based on the time of the onset of the stroke. So if you have the time of the onset of the stroke, you can link that with the data set of air quality that comes from these pollution control devices, and that's what these investigators did. Published their results about a little over a year and a half ago. And they found that if one of these peaks in air pollution occurred about 12 hours before the stroke, he had about 10 to 12% increase in the risk of having a stroke. And similar results have been found with potentially fatal cardiac arrhythmias detected by pacemaker defibrillators and myocardial infarcts. There's also good, excuse me, good data from the Medicare database that show that there is an increase in the risk of admissions for a variety of cardiovascular diseases that are associated with small particle pollutants. Now let me shift gears now away from small particles and the criteria pollutants to mercury. And clearly burning fossil fuels breed coal, because other fossil fuels have virtually no mercury in them, that burning fossil fuels or coal is the single leading anthropogenic source of mercury in the world. And what happens when this coal is burned is that the mercury comes out through the smokestacks, gets emitted into the atmosphere. It collects on small droplets that then collect in waterways. And in the waterways, there are bacteria that convert this elemental mercury into methyl mercury, which is a highly toxic and persistent and bioaccumulating neurotoxin that enters the food chain. And as small animals are eaten by larger animals, this methyl mercury bioaccumulates, particularly in large predatory fish like large tuna, tilefish, swordfish, and some of the other very large fish like king mackerel. Then they are eaten by people, and the people bioaccumulate the mercury. Now, sadly, the fetus also bioaccumulates mercury, so that the concentration of mercury in fetal cord blood is higher than it is in maternal blood. And this is a map that shows the concentration or the deposition of mercury. And again, here in the eastern part of the United States, as you might expect, where those dirtiest coal-fired power plants are located, mercury deposition is at its highest. Also Eastern Europe, parts of the Soviet Union, and of course in China and eastern parts of Asia. And not only does this mercury fall to the ground nearby, but some of it gets wafted into the upper atmosphere, where, as shown in this computer modeling, some of this mercury will go all the way from eastern parts of Asia to the United States. So this becomes a worldwide problem. Now, I mentioned that mercury, or particularly methyl mercury, bioaccumulates, and these are the data that show some of that bioaccumulation. Here on the vertical axis, you see a change in concentration ratio of over a million-fold increase. And as we move through the different species, from water concentration of methyl mercury to phytoplankton to zooplankton to fish that eat plankton, fish that eat other fish, and then finally loons that eat these fish that eat other fish, the concentration increases by a factor of about a million. So one of the take-home lessons here is don't eat loons. Now, mercury is a neurotoxin, and if we just zip down to the bottom of this slide here, EPA data indicate that among the most highly exposed individuals in the United States, and these are the top 10% of African American women who catch fish as a major source of protein for the diets of their family, the mercury in these women that gets then passed on to their children may reduce IQ by as much as 7 to 11 IQ points, significant reductions. Well, let's turn to global warming. Is it real? Yes, I'll show you some of the data to support that. Is it due to human activity? Definitely yes. There's a number of factors that lead to this conclusion, including correlation with fossil fuel consumption, and of particular interest to me, because I think it's just neat, is measurements of the carbon-12, carbon-13 ratio in the atmosphere as a function of time. and comparing that with the carbon-12, carbon-13 ratio that's present in other carbon-containing compounds that are not derived from plants. Now it turns out that carbon-12 is about 99% of all of the carbon that's in the world. There's about 1% carbon-13. These are both non-radioactive, so they stay that way basically forever. And the enzyme systems that are responsible for catalyzing photosynthesis prefer one of these forms of carbon over the other. So the plant life is enriched in one of these species of carbon. I believe it's the carbon-12. So that when you compare the carbon-12, carbon-13 ratio in plants to the carbon-12, carbon-13 ratio in, say, limestone, you find that it's enriched. And when you burn plants, and coal and fossil fuels are largely carbon that is derived from plants, it increases this ratio in the atmosphere. And one of the things that's been found to occur is that this ratio is becoming more and more like the plant ratio and less like the ratio that's found in very old specimens of air and air bubbles that have been trapped in glaciers and in ice packs. Now, the real story for those of us who are health professionals is the health effects of global warming, and we're looking at a public health disaster in the making. Heat illnesses are already the leading cause of death in the United States due to weather-related problems. We can expect increases in the drought, such as the one that we had in the Midwest last year, and floods, such as the one in Colorado not too long ago, changes in a pattern in the prevalence of infectious diseases, and an expected increase in the number of environmental refugees, such as those that were created by Hurricane Typhoon Haiyan in Philippines and rising sea level. Now, global warming is caused by the greenhouse effect, so that solar energy that comes to the Earth, some of that is absorbed by the surface, and some of that is radiated back out into space. And the greenhouse gases that are in the atmosphere capture some of this surface radiation of infrared energy and then re-radiate it back towards the Earth and in other directions. And it's this re-radiation of infrared energy that's responsible for greenhouse gases. And different gases have different abilities to contribute to this problem. Carbon dioxide is the most important because its concentration is the highest, but others such as methane, nitrous oxide, and fluorinated hydrocarbons are also important sources. Now, this is a part of a record of temperatures since 1950 that shows that indeed we're getting warmer. And the time period between 1960 and 1980 is typically shown as the baseline against which other temperatures are compared. And you can see that from this graph here, incorporating data from 4 different independent sources, show that temperatures are gradually increasing. And that so by the year 2010, average temperature on the Earth is about 0.8 of a degree centigrade higher than it used to be. Now, there are other temperature measurements that date back as far as 65 million years, and others that are more certain that date back over 800,000 years that show that the concentration of carbon dioxide in the atmosphere at the present time is at an unprecedented level, and that temperatures are rising at a rate that has not been seen in historic times. This is a graph that shows the concentration of the 3 largest global warming gases, carbon dioxide, methane, and nitrous oxide, in the atmosphere during the last 2,000 years. And you see as the beginning of the Industrial Revolution, which occurred right about here, we started burning large amounts of fossil fuel to generate energy, and the concentration of these 3 global warming gases increased dramatically. This methane number is slightly wrong now. The methane global warming potential at 100 years now is believed to be 20 instead of 21, but its contribution at 20 years is 86. So it's 86 more times more potent than than carbon dioxide 20 years after the emission. Now these are data that just became available this week and show the rate of growth of CO2 emissions worldwide. And 54% of the growth of CO2 comes from coal, which you can see increasing quite dramatically beginning around the year 2000. And a great deal of that is coming from new coal-fired power plants in Asia, particularly in China. Now this is the Keeling Curve, and this is one of my favorite slides in this whole business here, and it's of importance for a number of reasons. First of all, beginning in the late 1950s, Professor Keeling, whose life's work it was to measure the very small changes in the concentration of carbon dioxide in the atmosphere, started reporting this at the Mauna Loa Observatory in Hawaii. And what he found was that there was an annual cyclic change in the concentration of carbon dioxide that peaked in the northern hemisphere in spring. And as plants grew and leaves formed and trees and other plants had their spring growth spurts, the concentration of CO2 fell until the fall when these growth spurts came to an end. Leaves fell from the tree and plants entered a largely dormant phase. So every year we see this up and down, but the trend is inexorably increasing. Now Keeling's son was also an interesting character. His job was to measure the small changes in oxygen that occur in the atmosphere. Now remember from high school chemistry, when you make carbon dioxide, you take an atom of carbon and combine it with 2 atoms of oxygen to form carbon dioxide, or CO2. So one would predict that if the carbon dioxide increased in concentration, you ought to be able to measure a small concentration decrease in oxygen. And that's exactly what Keeling's son found. So there's a second Keeling curve, that's sort of the mirror opposite of this one, that shows very small decreases in the the oxygen concentration and this annual cyclic variation. Now I mentioned, let's shift gears and talk more about health. I mentioned that deaths due to heat-related illnesses are the single most important cause of weather-related deaths, and between 52 and 70,000 deaths occurred in Europe in the summer of 2003 due to a heat wave that was unprecedented in recent history. And we've seen other heat waves, one in Chicago in the 1990s and others that weren't quite as severe. So we can expect more of that. Now, diseases, particularly those that are caused by insect vectors that carry viruses and protozoas, such as malaria, are also expected to change in their distribution. So that the malaria map that's predicted for the future predicts increases in the prevalence of malaria in the sub-Saharan regions of Africa and in the northern parts of India and Tibet and Nepal. These are areas where malaria is not at its peak incidence. There are some areas where it's so bad that it's almost impossible to envision it getting worse. But these border areas are the areas that are at risk for having increases in the prevalence of malaria. Dengue is another disease, and this is the CDC Dengue Map. And if you Google that, you'll go there, and if you click on each one of these little buttons, you'll see that there is a specific reported outbreak of dengue that's shown there. And there are somewhere around 350,000 cases of dengue per year. By the year 2085, the prediction is that between 5 and 6 billion people, that's almost half of the world's projected population will be at risk for contracting dengue. And these again are the areas where the burden of the disease exists at the present time. A couple of years ago I was in the northern part of God's got my tongue here. This country here in South America, and in the airports you could see signs warning about dengue outbreaks and urging people to take measures to control dengue. 2012 was one of the worst years for West Nile virus in the United States. This is a map that shows the location of this outbreak. A lot of it in Texas, particularly in the Dallas area. There was spraying. Michigan, there were outbreaks, and also in Maryland. So all of the folks who are on the phone here tonight live in areas where West Nile virus and encephalitis had a peak incidence in the summer of 2012. A similar peak occurred in Europe in the summer of 2010. Again, that was thought to be related to increases in temperature and precipitation. This is the U.S. Drought Monitor report from August 28, 2012, and shows the huge area of the central part of the United States that was affected by a severe drought, which reached exceptional levels, as shown here in the brown areas. I was traveling through a good deal of this part of the country at that time on a speaking tour after the publication of the book, and everywhere I went you could see the impact of that drought. Severe weather events such as Hurricane Sandy, Superstorm Sandy, are expected to become more severe as time goes by. This is a cartoon that was published in the Buffalo News over the weekend, last weekend. This map of Southeast Asia shows China's carbon footprint treading down on the Philippine Islands, and we've all seen pictures of that disaster. This is a bit out of order here, but as a result of the drought that I showed you here a few moments ago in the midwestern part of the United States, the World Bank, in a report issued the end of August, showed that world food prices increased by 10% just in the month of July alone, and this increase was triggered by the Midwest drought. So what does that mean for the world? That depends on food that comes, a great deal of which comes from the United States. So this is another World Bank report from their food crisis report of September 3rd, 2012, and that shows that in many countries, particularly in sub-Saharan Africa and India, the prevalence of malnutrition among children under the age of 5 is close to 50%. And as food gets more expensive and more scarce, and there are other crops such as wheat, rice, and soybeans that are also experiencing reductions in yield that are related to temperature and rainfall changes associated with climate change, food is going to become more scarce and malnutrition more common. Sea levels are rising. They're predicted to get worse, and the people who are at the greatest risk, storm or not, are those who live in the delta areas of the world where there are very high concentrations of individuals living. So then the Nile Delta, the Ganges Putra River, the Mekong River Delta, their extreme risk by the year 2050, where 1 million or more individuals will be subject to displacement as a result of increasing sea levels. And of course there are some countries that will be entirely obliterated because the entire island nations that are present in some parts of the Pacific will be underwater as a result of rising sea levels. And shift gears again and talk just a bit about the Clean Air Act. And this is arguably one of the great public health triumphs of the 20th and the 21st century. The Clean Air Act is responsible for getting rid of lead in gasoline. It gave my children now in their 30s and 40s, 5 to 7 IQ points. This was signed in 1970. It established the EPA, whose mission is to protect human health and the environment. It was amended in 1990 during the administration of the first President Bush, and gave EPA the authority to regulate point and mobile sources, lead power plants, and vehicles that are on the road. And as a result of the Clean Air Act, the concentration of sulfur dioxide emissions have gone down significantly, as have the emissions of oxides of nitrogen. And this has been translated into health benefits and savings in healthcare expenditures. And this is a graph from an EPA report to Congress. EPA is required to make these reports periodically as a provision of the Clean Air Act. In the most recent of these reports, the prediction is that by the year 2020, the benefits in terms of reduced healthcare costs of all types, this has to do with deaths, premature deaths that are prevented, asthma attacks that don't occur, lost days at work and at school, all of which can be monetized by healthcare economists, all add up to about $2 trillion per year. That's trillion with a T, at a cost to industry of about $65 billion per year. Pretty favorable return on the investment. Now, guess who has the money to lobby Congress? It's these folks here that are bearing the cost. About $10 billion of that $65 billion is attributed to changes in power plant pollution control devices that will be mandated. So these are the people who have the money to lobby. These are the people who are affected. A lot of these folks are Medicaid, Medicare, don't have organized lobbies, and can't go to Congress and say, give us even cleaner air, because that's possible. So I regard this as a win-win-win scenario. It's a win because as healthcare professionals, the Clean Air Act is improving the quality of the air, it's preventing premature deaths, and it's making this a healthier world in which to live. So that's the first win. The second win is that we're spending less on healthcare because fewer people are being made ill and developing fatal illnesses that are very expensive to treat. Healthcare costs are rising astronomically, as all of us in the healthcare industry know. We have had our feet held to the fire, and justifiably so. So this is a good way of reducing healthcare expenditures, the second win. And the third win comes from looking at who pays the bills, who saves the $2 trillion. A lot of these healthcare costs are being borne by the federal government and state governments through Medicare and Medicaid expenditures. So this is a way of controlling healthcare expenditures and secondarily the debt, which is a huge problem, exaggerated perhaps according to some economists, but a problem that needs to be addressed nevertheless. So a way to do this and get the third win is to continually improve the quality of the air. So what are the solutions here? Well, we've talked about all the bad things that are happening, but there's some really good things that are happening as well. People are getting healthier. There are fewer people who are dying and getting sick as a result of these illnesses. There is still more that can be done. About 40% of the energy that we produce is wasted. So the cheapest, most cost-effective way of improving the energy situation is to improve the efficiency with which we use energy. Use more renewable sources, increase reliance on wind and solar energy. There are published proposals that show that with existing technologies for wind and solar and water energy, that we can convert virtually all of New York State's energy needs into wind, water, and solar power in the very near future, making use of the enormous amounts of energy that are available. So that more solar energy in the form of photovoltaic cells, solar-powered boilers, and promoting things that are now laboratory tricks or experiments, And in order to do this, we need to support education that makes the research possible, and we need to support the research that are going to convert some of these laboratory experiments into large-scale possibilities. This is a photovoltaic solar resource map of the United States that shows that somewhere around 11,000 times as much energy as we consume each year comes to the Earth in the United States absolutely free of charge. So we don't have to harness very much of the solar energy to make an enormous difference. Almost 100 times as much energy as we require is present in the form of wind energy. And when I was in I was told that something like 28% of all the energy that's used in Iowa now comes from wind energy. And there are large wind farms in the panhandle of Texas where farmers have a crop that never fails, wind, where they're setting up large wind farms to harness some of this wind energy that's present. And this is an experiment from the laboratory that shows the generation of hydrogen gas on one side of this grid and oxygen gas on the other side of the grid when sunlight is shown on this metal catalyst. So you add these catalysts to the cell, illuminate it with light, and you bubble oxygen in the front and hydrogen in the back. You can store the hydrogen and use it at night when the sun's not shining. And there are other sources of solar energy that can be stored at night in the form of some of the newer power plants that take the solar energy and heat sodium and liquefy it, and then that sodium is used at night to generate steam and power generators. So these are some of the things that are on the horizon that are imminently achievable given sufficient political will to do that. So some of the things that you can do to take action, that you can encourage people in your chapters and your colleagues and your candidates to do is to ask them if they support EPA's current clean air and carbon dioxide emission standards. New carbon dioxide emission standards are in the news a lot. There's currently EPA listening sessions going on around the country that EPA will use as it formulates regulations that are expected to be published next summer to limit CO2 emissions from existing power plants and their proposed regulations for new power plants. You can speak to your friends, family, and colleagues about the importance of clean energy and protecting your health, and you can join and support organizations like ARIS-PSR. So with that, I'll conclude. This is a picture of what we're doing in our home here in Buffalo. We have a 4,400 watt photovoltaic array on our roof that generates somewhere between 80 and 85% of all the electricity that we use. We drive energy efficient automobiles, with apologies to those of you in Michigan. This is a foreign car, but had you been making that in Detroit when we bought this one, we would have bought it. And we're replacing our compact fluorescent lights with LEDs. We put a whale of a lot of insulation in our house after we bought it. We found that the exterior walls are 8 inches thick, and that's a whole mound filled up with insulation materials. So thank you all for attending the webinar tonight, and I think that what we're going to try to do now is open this up to questions for the discussion. Hopefully all of you will have a little control panel in the upper right-hand corner of your screen that shows a microphone, and if you click on that, with any luck at all, you'll be able to unmute your microphone and ask a question.
Yeah, Alan, this is Tim. I had a question on particulate matter 2.5, the really small matter. Does that pass through the lungs into the bloodstream, or does that just lodge in the lungs and cause respiratory problems?
It does all of the above. Those are particularly nasty, and the reason they're so nasty is because they're small and they're inhaled deeply into the lung. so that they will stimulate the dendrite cells, which are part of the immunologic chain, and that begins to launch a chain of reactions that trigger immune reactions around the body. Some of these small particles pass right through the membranes in the lung, in the alveoli, and enter the bloodstream. And some of them pass through the cribriform plate in the nose, where neurons from the olfactory nerve that go directly into the brain pass through the skull and into the nasal passages. So there are a number of ways that small particles can gain entry directly into body tissues other than the lungs.
Okay. And so can these be heavy metals, or with the coal combustion and the emissions from coal plants, other than being, you know, really small and passing into the body, are these some of the heavy metals that are a danger, or is that something separate?
Yeah, and this is an area that's just being scratched by EPA and others who are looking at this. There's I'm blanking on the name of the lead investigator in this project, but one of the principal investigators of the Harvard Six Cities studies has been looking at the content of small particles. And she and her colleagues have found that it's possible to classify the origin of some of these small particles by their chemical composition. So, for example, the ones that are rich in silicon appear to come from dust, which is a problem in sub-Saharan Africa. The stuff that the particles that contain metals like selenium and other heavy metals come from burning coal, and those are in this study linked with the more severe health effects. And then the particles that contain large amounts of lead are believed to originate from internal combustion engines. Now, this is using older small particle samples, so that some of that lead is disappearing as leaded gasoline is basically gone from the scene, but there's still lead in some of the bearings in internal combustion engines. So I think that if you look at the history of the study of small particles, you'll see that the first limitation was being able to detect them at all. And the early detectors detected the concentration of 10 microns and smaller. Then as the technology got better towards the end of the 1980s and the 1990s, it was possible to measure the small particles that are 2.5 microns in size and smaller. And so it's only been in the last 15 years or so that we've had good data about those from direct measurements. I would predict that the next milestone would be looking at the chemical composition of the small particles to further refine our ability to find out which are the ones that are really the most damaging to health, so that regulations can be targeted specifically at limiting the sources of those more injurious particles. So this is an evolving story, I think.
Thank you.
I think Shan Gordon has a question. Can you go ahead, Shan?
I can't hear the question.
Actually, looks like they're muted.
You probably have control over the muting.
No, it says self-muted. Well, are there any other questions?
I don't hear any other questions.
Let me just make sure everybody's unmuted.
Hear a lot more background noise.
Hello?
Go ahead.
Hi. Yeah, what's your feeling on the plants in China? Would we have done better to keep the coal plants over in America, or I mean, that's a nasty question. Would we have done better as far as pollution goes to keep, you know, more clean coal going here?
Well, it's sort of a moot question because the Chinese are going to do what the Chinese are going to do. So we don't have any control over that. I think we actually, if you want to look at emissions from some of these sources, if you could mute yourself and then if you're not asking a question, I think the audio quality will be a whole lot better. Some of the least polluting power plants are in India and China, as well as some of the newest ones here in the United States. It's more a function of age than where they are. I'm not hearing any questions. I'm just hearing Julia, if you're still on the line, is there any way that we can enable the chat feature?
Yeah, I think people can type into the chat window if they have a question.
Well, I'm not hearing anything other than noise, and I'm not seeing anything appear in my chat window. So we're 8 or 9 minutes past, I think, what the targeted end time is. Stephanie, are you there? Are we done?
Oh, actually, I see some questions here now if you want to answer them.
I don't see them.
Does the proposed CO2 standard affect currently operating coal plants or just new ones and modifications?
At the present time, there aren't any regulations that affect any CO2 emission criteria. There's 2 sets of regulations that are in the hopper by EPA. The ones that were announced in September of this year pertain to new power plants that will be built beginning, I believe, in 2 or 3 years that will restrict the new coal-fired power plants to basically the CO2 emissions that are presently achievable with natural gas-fired plants. So that the only way that you would be able to build a new coal-fired power plant in the future with these regulations go into effect would be to utilize carbon capture and sequestration technology. Right now, EPA is listening for comments, and next summer will propose regulations for existing power plants. And the expectation is that they will be finalized sometime in the summer of 2015.
Okay, and one last question. Do you see any Parkinson's or other neurological impacts from cold that you didn't mention in your lecture?
There are some indications that Parkinson's disease might have air pollution exposure as a risk factor. That research is not as firm as certainly the four leading causes of death in the United States and the indicators that diabetes and Alzheimer's disease may be related to coal pollutants.
Yes, thank you, Alan. This is Tim. If there are no other questions, Stephanie just emailed me and said she's having trouble being heard. So she wanted me to thank you again for doing this. Is this presentation available, do you know, on the PSR website? I do know for those of you that are not familiar with the PSR website that there is material similar to this, but is this actual presentation, do you know?
Well, it's not currently available, but I see a little button that says that this session is being recorded.
Okay.
Yeah, we're going to have a video of this posted.
Great. Okay, thanks, Julia.
So when that goes up, you can send out an email to the known universe, I guess.
Okay, great. So on behalf of Stephanie, I wanted to thank you again, Alan, and thank everyone for attending. And please don't hesitate to contact Stephanie or myself if you have any further questions or follow-ups.
Okay, great. Thank you very much, all of you, for attending, and I hope that it was a worthwhile evening.
Very much so. Thanks.